This is my old sump pump here. It doesn't work anymore, but I can assure you I'm not hanging on to it out of any for any sentimental reasons. I replaced it. I put in the new sump pump myself, and so there's no plumber to haul away the old one. So I just haven't got around to figuring out how to dispose of this properly, the old sump pump. I'm assuming I can't just toss it in the trash. So that's the reason I still have it here. And the reason I'm showing you this is that I think that some pumps and healthcare coverage have a lot in common, insofar as they're both a purely utilitarian, serve purely utilitarian function, a utilitarian role. They don't have a dual role like some of our possessions of both a utilitarian and a ethereal, sentimental role, such as like some things like automobiles or shoes and clothing or houses. Those sort of things can often have a dual role of both serve a purpose, such as a car gets you from point A to point B, but it also people get attached to them, and they develop they attach a sentimental value to those items often, in addition to the role that they serve to utilitarian roles, such as the houses shelter you, and clothes shoes protect your feet, but something like a sump pump, that just I don't think many people develop a sentimental attachment to their sump pump, and that's the same thing I think with healthcare coverage. It only serves a purely utilitarian role. So when people say they like their healthcare coverage, they don't mean they're like getting attached to it emotionally. It means that it gets the job done, just like with my sump pump. As long as it gets the job done, yeah, I like it. But it's not something that I like in the sense of I've grown emotionally attached to or anything like that. And so that's why when people age into Medicare at 65, they don't start crying and bawling because they're going to lose their private insurance that they like so much, and are getting forced into this one-size-fits-all government Medicare. Rather, in general, they're just fine with it because the Medicare gets the job done. And the same thing would happen with Medicare for all. It gets the job done. And so I think that a lot of these corporate Democrats and corporate media, they're conflating the something that's purely utilitarian, healthcare coverage, with some things that have the dual role of utilitarian and a role of a sentimental, ethereal value, such as those like the cars and clothes and shoes and houses, which is misleading. I think they're deliberately misleading in order to help the insurance industry, because there's healthcare coverage is not something that people get a sentimental attachment to. I think we could think of it as like, imagine, I think most people, pretty much everybody, they own their sump pumps. All right. Well, just as a thought experiment, imagine, for instance, if it was a situation where everybody rented their sump pumps, and they pay a company to maintain them and replace them when they break, or and they had to pay a monthly fee to those companies. And then just imagine there was a legislation in that scenario where it was enacted, where sump pumps for all legislation, where suddenly you no longer would have to pay a rental fee, and instead the government would come in and assign you a sump pump, and you no longer have to pay the rental fee for that for that sump pump. And as long as it would just still get the job done, you get the water out. Like I have to have a sump pump here, or my basement will flood. As long as it kept the water out and kept my basement from flooding, I'd be like, great, that's awesome. That you guys came in, the government come in and gave me these one size fits all sump pump, because I don't care as long as it works. And that's be the same thing with Medicare for all. People would say, well, as long as I'm covered, they don't care if it's if they lose their old private insurance, because it's a private healthcare coverage is a purely utilitarian role, utilitarian function. There's no sentimental value attached to it, in addition to the utilitarian role. So as long as it gets the job done, people would be just fine with it. They'd be great. They would be more than fine with it. They would think it's wonderful, just like people think it's wonderful when they when they age into Medicare and no longer have to pay huge monthly premiums to to maintain health care coverage. And so, yeah, that's why I think there's a lot in common between sump pumps and health care coverage, and why it's misleading to say people like their to claim that people like their private insurance in the context in the sense of the term "like," that some of these corporate Democrats and corporate media people are using the term "like." It's purely it's misleading. It's dishonest the way they're using that term. Like their private coverage, they would like it just the same, if not more. They would likely like it more, their healthcare coverage, once they get Medicare for all, because they don't have to pay any premiums anymore. And that would be how. So there should be. I think it would be really popular. It'd be more likely to pass if people would realize what how Medicare coverage is a purely utilitarian role, and it would get the job done just as well as their private insurance that they like so much. Yeah, so that's the only point I wanted to come bring across here. I guess that's all I have to say for now. And thanks for watching. Yeah.